Movement disorders, the most common one being Parkinson's disease, used to be called subcortical dementias. This is my one disclosure that I've mentioned before. I won't talk about this in any way. And this talk is basically a very sort of image and information-rich presentation of the 5 most common movement disorders that have imaging correlates. And I'm going to talk about each of them individually, starting with the most common and most important one for you to understand, which is Parkinson's disease. And for each of these, I'll show you a sort of key slide that we don't have time to review in detail, but will be available for you to review upon getting home and wanting to follow up, that describes pathology, risk factors, epidemiology, classic clinical presentation, and gives you a reference that I think is a key reference for understanding that disease. I'm going to emphasize really the imaging side of it, and I think the other important point that I think leads to a lot of confusion within movement disorders, particularly for radiologists, is that there is often this discordance between the clinical or the radiology presentation and the actual underlying pathology. And unfortunately, we haven't really solved that problem completely, but I think it's one of the reasons that we sometimes get a little bit confused about what we're looking at. So the first one is PD, or Parkinson's disease. The classic histology that we see are these things called Lewy bodies that are sort of alpha-synuclein positive protein accumulations in the neuropil, neurite, or the cell body itself of the neuron. And again, this is a very dense slide. I don't want to go through this in detail. The classic sites that you first see pathology we'll review on the next slide. Some of the risk factors for Parkinson's disease are kind of interesting. So high dairy consumption, having a rural experience like being born and growing up on a farm actually increases your risk of getting Parkinson's disease, consuming well water. Some of the other ones are a little bit less common, amphetamine, methamphetamine use. It turns out that redheads have a higher risk of developing Parkinson's disease and melanoma, and there's likely a gene that predisposes them to that is also associated with hair color. There are some other genes, traumatic brain injury, excessive alcohol use, and there are a couple protective factors. So maybe this morning, drink more coffee than you usually do because it's been shown to reduce your risk of developing PD. I'll move on to presentation, and we'll show this again in a minute, but the sort of classic thing is sort of bradykinesia, rigidity, changes in gait, particularly asymmetric with a sort of resting pill-rolling tremor. And it is one of the most common forms of neurodegeneration, particularly for people over the age